Good morning, everyone. My name is Justin Kulovsek. I am head of digital and omnichannel engagement at Acceleration Point. I have over 20 years of omnichannel and digital experience, and I'm really excited today to walk through Omnichannel Without the Overcomplication. What you are going to see today is a practical 4-step approach that you can use today. You can actually start using these techniques this quarter. And we will be talking about things like how you focus on audience, align digital and field, and how you can really strengthen the scientific exchange. To kick things off, we have different challenges with Omnichannel. I'm sure most of you are having this challenge of one of your leaders or somewhere else within the organization, they start talking about Omnichannel. And so some of the challenges that people see right away when I'm working with them are things like, I have so many channels, I have tools, I have more data than ever before. I don't know what to do. I don't know where to start. That might be one of the challenges you're having. Another one might be more pressure to extend that education beyond your existing relationships. Another area which we will address today. And the third, more fragmented across teams, all these cross-functional partners potentially wanting to help with things, but at the same time, your calendar is also filled with a lot of other goals and initiatives as well that your organization might have. And so I think that is another big thing for us to remember is that, of course, challenges today, it's fragmentation because, hey, we need to actually work with this data team, or we need to work with our Viva team. So the first question that I actually have for everyone today, which is your biggest challenge, or is it something else? So the biggest challenge today that we are seeing is too many channels, tools, and data. And that is, of course, what we're hearing from people as well on this topic. What my promise to everyone that's watching, this is what you're going to leave with today. You're going to have a clear 4-step approach that helps you simplify this omni-channel execution. It will actually work. I have used this 4-step approach. I have 20 years of this type of experience. I have helped numerous pharmas and life science companies. And I will promise you that if you follow these steps, this will work for you. You'll be able to show how you have impact and that you can scale this with confidence. We are not going to overcomplicate this at all. And so really, this is the 4-step approach that I use when I am creating and developing a omni-channel strategy. And when we actually sometimes say omni-channel, people say, that's more aspirational, Justin. We need to start looking more at digital. And so this can also be used for a digital approach as well. But it really is the who, what, where, and how. And we're going to go through each one of these steps, and you are going to see how this is actually something I can do and I could start doing today. The first step to any digital or omni-channel campaign is going to be asking, who is that audience? Who is your audience? And the goal here is truly to identify them. And our biggest question typically on the medical affairs side is going to be, are we targeting an existing audience or a broader or a new audience? And what's the story with these HCPs? Do they engage with MSLs all the time, or are they what we are starting to call digital only? And that is definitely something that you're going to be seeing more and more of, I believe, especially even within 2026, is that you are going to see a shift where you will have some of your HCPs that your MSLs cannot interact with because there's just too many HCPs out there and a smaller MSL team potentially. And so they truly do become digital only. And so I think that is another piece to remember. Something else to think of, I have had people at this point sometimes stop and say, hey, I do have a question. And that is, my company doesn't feel comfortable with digital only. This is also where we start to say we need to start having a compliance conversation right away. If you do not have buy-in from your leadership, or your leadership potentially feels that omni-channel might be something that we can't do compliantly, start having that conversation. Have that conversation immediately with your compliance teams and really start to raise some of these questions of what can we do? What do we feel comfortable with as a company? And then maybe how can we continue to expand on that? So again, this step one truly is, who is your audience? I'm going to open up another poll and I'm going to ask, if you were to look at if you had to prioritize an existing or expand your audience, which one would you be working on today? This is really that step one. It's understanding not only your audience and who you're targeting, but also then, are we looking at an existing or expanding that to that new audience? Most people here are saying that we actually want to look at that new audience. And that's really where I believe that digital and omni-channel capabilities truly can have a major impact. Of course, that existing audience too, extremely valuable. This is also a great way for you to be able to engage with some of your HCPs as well. We move on then to step two, and that really is, what do you want them to do? And so in this case, our goal is to have a clear, simple, desired outcome. And I will say this is also where some people start to get a little stuck. We actually see medical affairs getting stuck in this area a lot. Most teams are focusing on what they want someone to do rather than that desired outcome. So this is where I like to say we need to change that DNA in the organization from how many emails are we going to send? How many people are going to attend our webinar? How many banners are we going to have on this website? How many social posts should we have? To, do I have a clear call to action that an HCP can engage with? And that truly is that step two. This is the what. What do you want them to do? So in this case, my question for everyone out there today, do you know what you want your audience to do? Do you typically today, do you know what you want your audience to do? Or are you sitting here going, I have no idea, because in the past, I have always sat here and said, my goal is, I want to know how many people are opening my emails, or how many people we're engaging with, or again, how many people are going to attend our webinar. So most people here do know what you want your audience to do. And we know that larger goal here is, of course, great scientific exchange between the HCP and the MSL or the company as a whole. Again, I'm going to end this poll, and we can see here that we do have a good 88% saying, yes, we do know what we want our audience to do, but we do have a few people on here also saying no. And guess what? The people that said no, that's okay. And that's really where we sometimes have to go back to that step one. We have to go back to that step one and saying, okay, who are we targeting? And now step two, what do we want them to do? What is it that we're trying to accomplish here? Sometimes people say, I really don't know where I need to start. And again, that's totally fine. And that's actually, most people don't know exactly where to start. They don't know who they're targeting specifically. Again, if it's that new audience or that existing. And then also that next question, what do we want that audience to do? Step three, where you're going to actually reach these audience. And so this is where it's selecting the right channel. And this is really important. And this is also one where, especially with more and more channels today, we have some internal pieces, like you might have an email system that you might be able to use, or a medical affairs LinkedIn channel that you can post things to. But again, the goal here is selecting the right channel, and it's really choosing the channel that's best for who you are targeting and what you want them to do. I know this seems very basic, but this is really how easy digital and omni-channel campaign setups can be. Now, again, we do have to say, choose that channel with a job to do. And so in this case, we are trying to reach more people. We want to build awareness and spark interest. Do we want to deepen that education, help them learn, evaluate, and build that confidence, convert, make them have that next step as well? Or is it to reinforce and to remind, support, and keep the momentum going? And so I think the big question here today, and one of the areas that I like to always say to people, when you're starting to look at your channels and what you might be able to accomplish with those, really, it comes down to, do you have channels today that are approved to use with these audiences? And so that is also a question that I will raise to this group. and say, do you know that you have channels today that you are approved, that you could start and launch a campaign extremely quickly if you needed to? About 67% are saying, yes, we know the channels that are approved and that we could utilize these today. And so this is, of course, really important. There are also going to be channels. Your compliance team might say, we're not comfortable with that today. If that's the case, that's another area that really sit down and have those conversations and say, what can we do? I have seen this time and time again where your compliance teams or even some of your business rules were developed 10 years ago, 5 years ago. Even if you were to say, hey, my business rules were done 2 years ago, 2 years ago, people were not talking about platforms like Open Evidence. People were just starting at that point to get into some of these closed off social media platforms like Sermo or Doximity, those types of areas. So those are things to also think about and saying, are our business rules really ready? And if they're not, how do we start this conversation? How do we have these conversations with our compliance teams? Very important for us to always think about as we're on this journey. Step 4 is, how will you engage with your audience? And this sometimes is where another medical affairs teams can sometimes get a little hung up on as well. The goal here is to use the right content for your target audience with the desired action and the channel you will use to reach them. And so what does this mean? We would never put up a full, huge white paper, for example, on a platform like LinkedIn. We would probably want to use a portal for that. A portal, of course, not only are we able to track who is actually coming to that portal and downloading maybe a poster or a white paper of some kind, but also we need to know that for the most part, we are dealing with HCPs that have so much going on. There's so many different competing things happening throughout their day. And although here we'll say sometimes you have about 30 seconds for engagement, I will argue that at times and say you will actually have 6 seconds to engage. And that is another big area that you will want to keep in mind, that we might only have a few seconds to actually have engagement with these people. So again, the goal here, use the right content for your target audience, the desired action, and the channel you will use to reach them. And so again, we know that, hey, if we're going to be presenting something, that might be better as a webinar or some kind of a speaker program. But at the same time, if we will be attending this conference, or Congress, and we would love to see you there. That might be something you'd put on social. Now, you are going to want to match the content to the moment. So these are the questions that I always like to ask people. Does the content make the action obvious? Do we actually have a call to action on there? Is it also the right level of depth for this channel? We don't want to get too detailed up front. We might say, hey, we're just going to give you a little taste. And then if you want more information, you will have to reach out. And again, once an HCP engages with this content, the next question within Omnichannel would be, what is next? So once we have this set up and we know our 4 steps of the who, what, where, and how, we will actually now go through and start to say, now, how do we build upon this? At this point, do you feel that you have the right content for the desired outcome? And so that is also just another big question. Or do you feel like we have some content, but we don't have enough? We also have limited bandwidth within our scientific comms team as well. So that's something else for us to think about. So again, sometimes having that right content for the desired outcome is also an area that people can get hung up on. This is also an area that I say to people, please make sure that if you are looking at content, it doesn't have to be the giant long presentation. It could be a snippet. It could be a part of it for engagement. And so 83% of you actually say that, no, I don't feel I have the right content for these different outcomes. And again, we then have to sit back and say, how do we achieve that? How do we leverage some of this information? How do we actually, some of you might have been here also hearing buzzwords like modular content. Modular content is something that people get really excited about, and then they pause because no one in the organization truly knows how to do it. That's another area. Modular content is something that I helped launch at 2 different pharmaceuticals on the medical affairs side, and we actually had great success. We had great success being able to say we can leverage this information onto these different channels on that content side of things. Someone did ask, how do you decide what is the right content? What are those considerations? And so in our case, I would actually say that right content, it all comes back to this 4-step approach. We know the who, the what, the where, and the how. And so if we know who we're targeting and what we want that desired outcome to be, that is when we figure out, is this going to be too much content for this channel? That's really where I usually start with things from that perspective. So the last question here that isn't part of this 4-step is really proactive versus reactive. This is a question you must ask. And of course, the question is the content and topic that you are trying to engage with approved for proactive or reactive use? And if for some reason you say, I don't know at this point, this is a great time to have a conversation with your compliance team. And also, this is where every pharmaceutical is going to have a different approach to this or a different philosophy. I have been hearing lately that some medical affairs teams are actually doing away with proactive or reactive. Again, very different way of thinking than we've ever thought within medical affairs. But that is an area also that we are actually looking at, that some people are having conversation. I still feel that to be compliant, you do need to think about proactive and reactive use. But again, this has to be a question within that content conversation as well. So again, this is your 4-step approach: the who, the what, the where, and the how. And I guarantee you that if you use these 4 steps, you are going to be successful. We're starting off extremely small. This might be something like a 2-week campaign of some kind. You are going to start small. Your continued success is going to lead to full omni-channel orchestration, which, as you see on here in this graph, we start off extremely basic and easy, a small group that we're targeting here. But just think of when you have multiple campaigns targeting the same audience, you're going to have multiple channels to manage and coordinate. You're going to have longer timelines. You're going to have one of your leaders say, we want to have an always-on omni-channel approach, and we don't want to worry about a 2-week push for that Congress. And of course, you're also going to have competing priorities. And so in this case, this is truly where Acceleration Point can help. We can help really from these fast-focused campaigns to always-on omni-channel programs. This is where, again, they're not 2 weeks. They could be months. It could be a full year as well. One thing I would say at this point, if anyone right now says, I have no idea where to start, we can schedule a 20-minute call to just talk about your challenges that you might be having. That is something that I am more than happy to offer to everyone here. Just really going through can be able to help you on that side. We do have a few questions that came in. What channels do you use? This is actually get this all the time. It's really going to be depending on the type of campaign, who we're targeting, what we want them to do. And so in our case, sometimes those channels could be those internal ones, like I mentioned, your website, your email, your potential CRM or Salesforce Cloud, if you will. But it could also be putting things out on channels like LinkedIn. It could be Medscape, Doximity, Sermo, Open Evidence. All of these different channels are available today. And really, we really need to start thinking about this. And again, you will also have times where your compliance teams might say, we don't feel comfortable with this. Let's have those conversations then with them. That is another area where we can help as well at Acceleration Point. But for channels, there are so many out there. However, again, it's knowing who you're targeting and what you want them to do And that is going to help drive where you should be putting that message and having that scientific exchange. We did have a question, how do you attract your audiences? And again, with this, I would actually start with that question of, are we looking at a existing or are we looking for a new audience? If it is an existing audience that we can engage with, that's one thing. If you're attracting that audience, it might be looking at some of these additional channels that are outside, some of these virtual channels, if you will, like a closed social media platform for HCPs. So that would definitely be one of those areas to look at. If you do need help, I would invite you to reach out. I am more than happy to set up some time and chat with you, and really appreciate everyone's time today, and have a wonderful day.